Today we're going to talk about contract management system and the difference between a contract management system and having a contract performance system. So Richard and I are going to talk about the differences and what are some of the key aspects to look for as you're measuring your contract performance. A lot of hospitals have contract management systems. So those are software systems that manage agreements, and they're absolutely essential. They come in different ways, shapes, forms. Hospitals use them in different ways. Some just put their contracts in them. Others are putting dates and filling those aspects in. And some are really, using the contract management system to see what's coming up, how they can put that together in a strategy. And these are all important. I think the gap with contract management systems is really how are you managing the performance of the agreement? So what goes on in terms of what's invoiced versus what's on contract? How are you measuring that? So there's this gap, right? So we help hospitals, in addition to having the contract management system, we help them measure the performance of their agreement. And how we do that is we do that through data analytics. And the data analytics is so important because you're able to take the invoices or your utilization data and measure it to your contract. What's going on? We help support quarterly business reviews. Every hospital should be having quarterly business reviews with their key vendors and suppliers. And number three, we're really able to help get those agreements teed up, ready for the renewal. So it's what are the variations? What's the off-contract spend? What are we doing differently? And it's this contract performance that really is a way for hospitals to outperform, to do better. What do you think about how we help hospitals with their contract performance?
So contract management systems are always like a little bit of false sense of security, because a lot of times you see, we have a contract management system, and then we start to ask for contracts, and it's like, oh, here are all the contracts. And well, it's not. We look at the spend again. Mapping the spend to the contract is really going to give you the insights on what's going on. And a lot of times it's, missing amendments, renewals, there's auto renewals, CPI increases, everything that's like embedded in these agreements. They're not fully optimized, or actually they're not fully recognized within the contract management system, right? Mm-hmm. So our strategies is, great, contract management systems are important, but how are you using it to manage your contracts, mm-hmm. right? So it's the spend to the contract. What do you have? What is missing? Where are the gaps? So it's really important to first and foremost is to map everything from a contract to a spend, and you'll see, maybe you only have 60%, maybe you have 50%, whatever that number is, that you need to close it to as close to 100% as possible, because that's where, when you start to optimize your contracts, that's when you maximize and optimize your costs and making sure that you don't pay for anything you're not supposed to be paying for.
Yeah, and that is an absolute great point, in that most of the times we're seeing when we're asking for contracts, we're probably only getting 50 or 60% of it. So that's always the first step. And then how do you manage? So we welcome reaching out to us if you'd like to learn more about how we help hospitals with their contract management system.